Good afternoon, everybody. On this Doctor's Day, awareness on antimicrobial resistance, a very less talked about and heard about topic, though it is a global problem now. In India, 2019, India recorded an estimated 2 million deaths due to antimicrobial resistance. This is from the Lancet 2022. It is a global burden of disease data. And some key facts on this problem. AMR is one of the top global public health and development threats. It is estimated that a bacterial AMR was directly responsible for 1.27 million global deaths in 2019 and contributed to 4.9 million deaths. The misuse and overuse of antimicrobials in humans and animals and plants is the main drivers in the development of drug-resistant pathogens. AMR affects all countries, all regions at all income levels, not just the low income levels, but all the developed countries also. And it puts a lot of strain on the medicine, so it makes infections harder to treat and makes many other medical procedures and treatments such as simple surgeries like cesarean sections and cancer chemotherapy, appendectomy much riskier and much difficult to treat. The world faces an antibiotic pipeline access crisis. There's an inadequate research and development pipeline in the face of rising levels of resistance. In addition to death and disability, AMR has a significant economic cost. So priorities to address AMR in human health include preventing infections and appropriate use of antibiotics. A brief overview on this topic. Antimicrobials include all the antibiotics, the antivirals, the antifungals, and the antiparasitics. Though there's a misnomer that antimicrobials is just antibiotics. It's not that. It includes all other. And all the medicines used to prevent and treat infections in humans, animals, and plants. Antimicrobial resistance occurs, it's a basic pathology, when the bacteria, viruses, fungi, and parasites no longer respond to the antimicrobial medicines. As a result of drug resistance, antibiotics and other antimicrobial medicines become ineffective and infections become more difficult to and impossible to treat, increasing the risk of disease spread, severe illness, disability, and death. AMR is a natural process that happens over time through genetic changes in pathogens. Its emergence and spread is accelerated by human activity, mainly the misuse and overuse of antimicrobials to treat, prevent, or control infections. It's a global concern. Antimicrobial medicines are the cornerstone of modern medicine. The emergence and spread of drug-resistant pathogens threatens our ability to treat common infections and even to perform life-saving procedures including cancer chemotherapy and simple surgeries. In addition to drug-resistant infections, impact the health of animals and AMR is a problem of all countries at all income levels. It spreads, does not recognize country borders. Contributing factors include lack of access to clean water, sanitation and hygiene for both humans and animals, poor infection and disease prevention, and control in homes, healthcare facilities, and farms. Drug resistance in bacteria is a major problem. The global rise in antibiotic resistance poses a significant threat, diminishing the efficacy of common antibiotics against widespread bacterial infections. The 2022 Global Antimicrobial Resistance and Use Surveillance System, the GLASS report, highlights alarming resistance among prevalent bacterial pathogens. The median reported rates in 76 countries have 42% for third-generation cephalosporins resistance, E. coli, and 35% for methicillin-resistant Staphylococcus aureus, which is a major concern. So why is this a national emergency for us? AMR is killing more Indians annually than cancer or diabetes. It's a silent pandemic. The AMR burden in India in 2019, India experienced a significant mortality burden due to antimicrobial resistance, with approximately 2,97,000 deaths attributable to drug-resistant infections and additional 10 lakh deaths associated with them. Young lives are lost. Majority of the AMR deaths in India occur in people under 50 years, which are the breadwinners of the families. Common surgeries like cesarean section or appendectomy are now life-threatening due to ineffective antibiotics. It's an ICU disaster. In some Indian hospitals, up to 70% of ICU infections are resistant to commonly used antibiotics. So we need a higher antibiotics. Newborn danger. AMR is the major cause of neonatal death due to untreatable sepsis. Poor and the rural are the hardest hit. Lack of access to second-line antibiotic leads to rapid deterioration in rural settings. Financial cost, this is the most important. Patients spend 50,000 to 5 lakhs fighting resistant infections, pushing families into poverty. So what does this mean? All that healthcare professionals, including the doctors, the nurses, the pharmacists, and policymakers, need to wake up now. India cannot afford to lose 2 million lives yearly to irresponsible antibiotic use and weak regulation. How can we prevent it? We have to prevent antimicrobial resistance by focusing on preventing infections, using antibiotics responsibly, and promoting good hygiene practices, including proper hand washing, food safety, ensuring antibiotics use only when necessary and prescribed. Hand washing, we all know. Vaccination is the key to prevention of infections. Food safety, practice safe food handling and preparation techniques. Safe sex is required. Environmental hygiene, maintaining a clean environment is important. Antibiotic use to be only when necessary, only to treat bacterial infections, not for viral or common colds or flu. Follow the prescriptions. Take antibiotics exactly as prescribed by a healthcare provider. Don't save antibiotics and never use leftover antibiotics, which we commonly see among the patients. पहले वाले पर्चे से दवाई हमने खा ली 5 दिन, अब असर नहीं आया, now we've come to you. That is what. Consult. This is very common. Consult your doctor. If you have any questions about your antibiotic treatment, or if you have concerned about the effectiveness, consult your healthcare provider. Role of healthcare providers: prescribe judiciously, implement antibiotic stewardship programs, educate patients about the importance of antibiotic appropriate use, infection control, strict infection control measures to be taken. So to raise awareness, we every year celebrate or observe World AMR Awareness Week, November 18 to 24. Handle antimicrobials, all the antibiotics, antivirals, antifungals, and antiparasitics with care to prevent this rising crisis. Thank you.